Thank you very much for inviting me to this talk. My name is Shephard Mpofu. I'm the Chief Medical Officer for Novartis Gene Therapies. My role is to oversee clinical development and medical affairs of our pioneering therapies on our platform on gene therapies. Thank you very much for that question. Spinal muscular atrophy, SMA, is a rare genetic neuromuscular disease and a leading genetic cause of infant death caused by the lack of a functional SMN1 gene. When left untreated, the most severe forms of SMA result in the rapid and irreversible loss of motor neurons, affecting muscle functions, including breathing, swallowing, and basic movement. Severity varies across a spectrum of types corresponding to the number of copies of the backup SMN gene. So majority, 70% of patients with 2 copies of SMN2 develop what we call type 1 SMA, which is the most common form, accounting for roughly around 60% of cases. Type 1 is very severe and left untreated leads to the death of the need for permanent ventilation by the age of 2 in more than 90% of cases. Most patients, in fact, 80% with 3 copies of SMN2 develop type 2, accounting for 30% of cases. Left untreated, patients with type 2 are unable to walk and will require a wheelchair. And more than 30% usually die by the age of 25. Loss of motor neurons critically cannot be reversed. So it is really imperative to diagnose SMA and begin treatment, including proactive supportive care as early as possible to halt the irreversible motor neuron loss and disease progression. Zolgensma is the only gene therapy for SMA and the only SMA treatment designed directly to address the genetic root cause of the disease by replacing the function of the missing or non-working SMN1 gene with a single one-time dose. As a transformative gene therapy, it is designed to provide what we call a lifetime of benefit. Zolgensma is an essential one-time treatment for patients with SMA, representing a completely new class of SMA treatment. Thanks for that question. I'm really excited to share with you that the completed phase 3 sprint data that we presented at the MDA reinforced data presented for the 2-copy cohort at last year MDA meeting by showcasing that children with 3 copies of the SMN backup gene treated pre-symptomatically with Zolgensma achieved age-appropriate milestones, including standing and walking. Specifically, 100% of patients, that's 15 over 15, met the primary endpoint of standing unassisted for greater than 3 seconds by 24 months of age, including 14 of these children whose milestone fell within the World Health Organization window of normal development. In addition, 95% of the children walked independently, majority of whom also did this milestone within the WHO window of normal development. I would also add that in addition to the sprint study, Novartis has presented a descriptive post-hoc analysis of the 3 studies we have done, the START study, the STRIVE EU, and the STRIVE US, with 65 patients in total that indicated children with spinal muscular atrophy type 1 achieved or maintained important measures of bulbar function following treatment with Zolgensma, including the ability to speak, swallow, and meet nutritional needs and maintain airway protection. Of the patients that could be analyzed against all these 3 critical components, 80% achieved this difficult composite endpoint. Thank you. I think there are quite a number of facets to the criticality of these results. We believe the sprint data in the completed 3-copy cohort represent a remarkable outcome that contrasts the natural progression of this devastating disease. As you know, without treatment, children with 3 copies of the SMN2 backup gene typically developed SMA type 2, which is characterized by the inability to walk independently. Whereas these data show remarkably that when treated with Zolgensma before the onset of symptoms, these patients are often achieving patterns of motor development which are indistinguishable from the healthy peers without SMA. The data also reinforce the importance of early diagnosis and treatment for SMA in optimizing patient treatment outcomes, such as through the implementation of newborn screening for SMA in every newborn. With regard to the bulbar function analysis I mentioned earlier, that is a composite endpoint that encompasses multiple factors that are affected by the integrity of the patient's bulbar motor neurons, as measured by an individual's ability to communicate sufficiently with comprehension by an unknown listener, the ability to swallow food and liquids. And this is really important because that's how kids can meet their nutritional needs and also maintaining their airway protection. So the effect of SMA type 1 on bulbar function often leads to debilitating complications such as an increased risk of aspiration, as well as significant social consequences from impairment of speech development. And lastly, from the post-hoc data, Zolgensma can have an important impact, not just on a child's physical well-being, but their quality of life as well, as they are able to communicate with family, swallow, therefore eat and drink independently, and not rely on any respiratory support and have a reasonable life. It is really exciting to see patients achieving these endpoints, and it once again confirms the transformative impact of Zolgensma in children with SMA and now in patients treated pre-symptomatically. These results are truly in sharp contrast to the natural history of the disease, and they again reinforce the value of newborn screening in SMA, which is vital to affording children the earliest diagnosis and treatment to ensure the best possible outcomes.